Welcome to this AgSafe educational video, Coronavirus COVID-19, Signs and Symptoms and Stop the Spread of Germs. The objectives of this video are twofold. First, we want to review the common signs and symptoms of coronavirus 2019, more commonly known as COVID-19. We also want to review the ways in which you can help minimize the spread of germs as identified by the Center for Disease Control, the CDC. First, what are the symptoms of COVID-19? The CDC has said that symptoms are reportedly linked to coronavirus COVID-19 can range from mild to severe. Most of these symptoms are common and may appear up to 14 days after exposure. It's important to know that one of these symptoms on their own does not constitute concern of having been exposed to COVID-19. But if individuals are experiencing two or more of these symptoms, they need to act accordingly. If an individual has a fever, in this case, a temperature of 101 degrees Fahrenheit or higher, does the individual have a cough? And in this case, is it a dry cough? And third, does the individual have shortness of breath? This is when the individual has difficulty breathing. It's important to note that this means shortness of breath when at rest. You're sitting down, not exerting yourself either through exercise or other physical activity. If you possess any of these three symptoms, a fever of 101 degrees or higher, a dry cough, or difficulty breathing, it's important that you seek immediate medical assistance. This includes calling 911 or going to your nearest emergency room. What can we do to stop the spread of germs? The CDC has some key elements that we need to keep in mind. First, avoid close contact with individuals who are sick. This is any individual who is potentially ill from colds, flus, or COVID-19. Since we cannot be sure based on looking at an individual what might be affecting them, it is important that you avoid close physical contact with any individual that is sick. Make sure that you cover your cough or your sneeze with a tissue and then throw the tissue in the garbage. Wash your hands often with soap and water for at least 20 seconds. Certainly, we're washing our hands when we come in contact with other individuals, when we use the restroom, when we're doing food preparation, but it's a good idea just throughout the day when you have access to running water and soap to ensure that you continue to wash your hands repeatedly. Please avoid touching your eyes, nose, and mouth. This can be difficult for many of us, particularly if we wear glasses or contact lenses, if we speak regularly through our jobs, or if we're experiencing cold-like symptoms. This effort is going to require diligence and a lot of active thought to avoid touching your eyes, nose, and mouth. Clean and disinfect frequently objects and surfaces that have been touched. It's important to ensure that in your home, in your workspace, in areas where you still may be connecting or congregating because you're providing support to elderly or other individuals in your life, to make sure that you are cleaning and disinfecting both surfaces like desks, countertops, furniture, and other areas that you might touch on a regular basis, as well as other surfaces, in particular light switches, door handles, drawers, the handles of commonly used areas like refrigerators, microwaves, your TV remote control. Don't forget your cell phones or your regular home phones. Things that you come in contact with regularly, it's important to clean and disinfect frequently. And if you are sick, please stay at home. In particular, if it is unclear to you what might be making you feel unwell, at this stage, it is prudent to take the necessary precautions and to stay at home to prevent the possibility that you will pass along whatever virus or bacteria you are carrying to other individuals. It is important to note, leaving your home to get medical care is appropriate and prudent. However, non-essential medical care should include a phone call to your doctor to confirm if coming in for that doctor's appointment is still a good idea. If you need additional information, we encourage you to visit the Centers for Disease Control website at cdc.gov. AgSafe has developed a COVID-19 resources webpage, and we will update it regularly with new information, resources, tools, and samples. Go to agsafe.org, and the link to the COVID-19 resources page is available on our homepage. Thank you, and as always, stay safe.